In a move that could redefine public health in America, Robert F. Kennedy Jr., the newly appointed Secretary of Health and Human Services, is dismantling the Centers for Disease Control and Prevention, CDC, an institution once regarded as the gold standard for evidence-based health guidance. This isn't just about politics. It's about the potential collapse of trust in one of the nation's most critical agencies. And this is the part most people miss. If we don't act now, the consequences could ripple far beyond vaccines, affecting everything from disease surveillance to biotech innovation. So, how do we respond to this unprecedented threat? Let's break it down. Dr. Ezekiel J. Emanuel, a leading voice in global health initiatives, alongside research fellows Abe G. Baker-Butler and Merjan L. Ozisik, have sounded the alarm on Kennedy's actions. By removing CDC Director Susan Monares and overseeing the resignation of her deputies, Kennedy has effectively cleared the path to reshape the agency into a platform for his anti-vaccine agenda. Despite promising not to undermine vaccine programs, Kennedy's recent moves tell a different story. His actions suggest a deliberate effort to erode the CDC's scientific integrity, turning it into an ideological tool aligned with the priorities of the Trump administration. But here's where it gets controversial. Kennedy's campaign against vaccines isn't just misguided, it's dangerous. Vaccines are among the most effective tools we have to prevent illness and save lives. Consider this. Since 1974, vaccines like the measles, mumps, and rubella (MMR) shot have saved an estimated 154 million lives globally. Even more recently, COVID-19 vaccines alone have prevented over 3.2 million deaths in the United States since their rollout in late 2020. These numbers aren't just statistics. They represent real people who were given a second chance at life because of science. Kennedy's assault on the CDC extends beyond leadership changes. Earlier this year, he disbanded the Advisory Committee on Immunization Practices, ACIP, replacing its 17 members, highly qualified experts, with individuals known for their skepticism of vaccines. Why does this matter? ACIP plays a pivotal role in determining which vaccines are recommended for use across the country. In many states, pharmacies are legally barred from administering vaccines that aren't endorsed by ACIP, and insurers typically won't cover them either. If ACIP stops recommending widely used vaccines, such as the annual COVID-19 booster or the childhood MMR shot, access to these life-saving interventions could disappear for millions of Americans. Imagine a scenario where a vaccine costs nearly $150 per dose, but isn't covered by insurance because it lacks ACIP approval. For countless families, this would mean choosing between paying rent or protecting their loved ones from preventable diseases. And while Kennedy claims the MMR vaccine causes autism, a claim thoroughly debunked by decades of research, his beliefs threaten to put one of the safest and most effective vaccines in jeopardy. Ironically, undermining the CDC might make vaccines less safe, not more. The agency operates the Vaccine Adverse Event Reporting System, VAERS, a crucial database that monitors vaccine safety. As experienced scientists leave the CDC due to political interference, the quality of this system is likely to decline. Doctors and patients may also hesitate to report adverse events, fearing their data could be weaponized by anti-vaccine advocates. This chilling effect would result in incomplete data, making it harder to identify rare side effects and ensure vaccines remain as safe as possible. Moreover, a weakened CDC could discourage pharmaceutical companies from investing in new vaccine development. If businesses believe their innovations won't receive ACIP recommendations, or worse, face regulatory hurdles, they'll divert resources to other areas. Adding insult to injury, Kennedy has slashed funding for cutting-edge mRNA research and cancelled contracts with the National Institutes of Health's Vaccine Research Center. These decisions cripple our ability to prepare for future pandemics and stifle advancements in biotechnology that stem from vaccine research. The politicization of the CDC doesn't stop there. Under Kennedy's watch, the agency risks becoming a propaganda arm rather than a trusted source of information. President Trump has a history of firing officials who publish inconvenient truths, such as former Bureau of Labor Statistics Commissioner Erica McIntyre. With scientifically minded leaders like Monterey's gone, the CDC may suppress or manipulate data to avoid embarrassing the administration. We've seen what happens when governments hide outbreaks. China's handling of COVID-19 offers a sobering example. Without transparent communication, the US public and researchers may remain in the dark during future health crises. So, what can be done? Congress holds significant power to reverse this trend. The House and Senate Appropriations Committees, along with the Energy and Commerce and Senate Help Committees, must step up. First, they should withhold funding for ACIP until Kennedy removes his unqualified appointees and replaces them with respected experts. Second, lawmakers must demand that acting CDC Director Jim O'Neill be replaced within 30 days by a qualified physician or scientist, not someone serving without formal nomination for 210 days. Finally, these committees need to restore funding for vital CDC programs currently under attack, including domestic HIV/AIDS prevention, family planning services, teen pregnancy prevention, and gun violence research. Senator Bill Cassidy, a physician and chair of the Senate Help Committee, bears particular responsibility. While he recently called for postponing an ACIP meeting, this gesture falls short of meaningful oversight. Cassidy must hold Kennedy accountable and leverage his position to prioritize America's health. Restoring the CDC isn't just about protecting vaccines, it's about safeguarding the integrity of science itself. This battle goes deeper than policy. It's about whether we value truth over ideology. What kind of legacy do we want to leave for future generations? Will we stand by as pseudoscience replaces evidence-based medicine? Share your thoughts in the comments below. Are you willing to fight for science, or will you let fear dictate the future of public health?